Readmission rates have been a problem across the country, and our membership is no exception to that rule. So we wanted to find a way to actually impact the outcomes of these patients. And hospital discharge to an acute facility where high-risk patients taking high-risk drugs tend to accumulate seemed like a natural opportunity for pharmacy services to attack the issue. In addition to that, prescribers don't always have full transparency or confidence into the medication regimen that they were discharged on, or even the medication regimen they were on prior to going to the hospital. And I think all of these issues and all these barriers were accumulative and led us to a pharmacy-based solution.
We wanted to focus on admission reconciliation and also the discharge reconciliation in the nursing homes. And so we comprised a team. We have a team of pharmacists and pharmacy technicians that go into the nursing home, and they work very collaboratively with the interdisciplinary team to just help our patients achieve great outcomes. Our pharmacy technician goes in and does a complete patient interview with the patient or caregiver, and it gives us a great understanding of actually what's in their medicine cabinet at home. And then we take that information, the technician gives it to the pharmacist, and the pharmacist looks at the patient interview list along with other materials such as the discharge summary from the hospital, the history and physical, claims information, EHR information from the PCP in the facility, and we gather interventions for the physician. At that point, we then go into the discharge reconciliation process. And this is very similar to our admission reconciliation review. However, we look at the discharge prescriptions that are written by the physician along with the facility EHR, and we have more of a focus on formulary preference, cost issues, adherence problems. And that gives the patient a better understanding when they go home. And the key is really to make sure that all of that is done before the patient leaves the nursing home to help with their outcomes and keep them at the center of their care. We provide a medication list to the patient as well as targeted patient counseling on some of their high-risk medications. And that combined with the physician, we're able to help that patient as they transition home. In 2018, our pharmacy team completed close to 2,500 patient encounters. And of those encounters, we had 5,000 medication interventions. 13% of those interventions were deemed high risk. And an example of a high risk intervention category that we typically see is an omission of therapy. Let's say the hospital physician wanted them to continue on an antibiotic. Well, that antibiotic was inadvertently missed when they went to the nursing home. So those are just some examples of some of the interventions that we catch on the pharmacy side, which is pretty exciting. We also do a survey of the patient just to see how they liked our customer service, and we have an 80.2 Net Promoter Score average, which we're very proud of. We obviously want to keep that patient home as long as possible, so some of these metrics are great to look at to make sure that those patients fully are at home for as long as possible. The most exciting part of all of this, I believe, is the avenues that it's opened up for pharmacy and OptumCare. And right now we're looking at expanding into the acute to home space, and this will hopefully bring more pharmacists into the fold and be able to provide great customer service to our patients.